Welcome to DC to Be Revolution, where students are thinking big to live large. I'm your host, Noah Volz, and today I'm here with Dr. Alan Goldhamer. Dr. Alan Goldhamer is up in Santa Rosa, California, and he's doing some really innovative, exciting, multidisciplinary healthcare up in that area. So thank you, Dr. Goldhamer, for being here. Looking forward to talking with you.
My pleasure.
All right. So I just wanted to start off and talk about some of the research that you've done. It seems like you've been busy publishing a lot of really interesting and exciting research. And I was hoping that you could talk a little bit about that and then provide any advice for students on how we can also conduct good quality research either in school or once we get into practice.
Absolutely. Yeah, we have a unique situation here at the True North Health Center because we do have both inpatient and outpatient care. So we have 58-bed inpatient facility that allows us to have people actually staying with us, and as well as the outpatient practice that goes along with each of the clinicians that work on our staff. We have 12 clinicians here, 4 medical doctors, 3 chiropractors, 4 naturopaths. We have a clinical psychologist, we have acupuncture, we've got all kinds of different people that make up the staff here. There's actually 53 full-time employees right now at True North Health. And it is really the only chiropractic directed inpatient facility operating right now in the United States. And so it lends itself to research. Essentially, we're a human subjects laboratory. We're actually designed to be able to ask and answer those questions that are related most relevantly to getting actual patients well. And our approach is a nutritional medicine approach. So we're using diet, sleep, exercise, as well as conservative care, not the least of which is manipulative therapy, to help patients overcome their problems. Now, most of the people we see are actually patients that have things like cardiovascular disease, like high blood pressure, diabetes, lots of autoimmune diseases, particularly rheumatoid and arthritis and lupus and ankylosing spondylitis. We treat lymphoma. We treat patients with conditions of dietary excess, conditions that are reversible by controlling diet, sleep, exercise, and most specifically medically supervised fasting. So we have patients doing fasting up to 40 days on water only. And as you mentioned, we have been able to publish a number of studies. Our actual first paper was, we took 174 consecutive patients with high blood pressure, and we put them through a period of 5 to 26 days of water only fasting, long enough to normalize their blood pressure, and then implemented an exclusively plant food, SOS-free, that is sugar, oil, salt-free diet. And we're able to demonstrate what turned out to be the largest effect sizes ever shown in treating high blood pressure in humans. That was a paper that we published with our co-author, T. Colin Campbell from Cornell University. It appeared in the Journal of Manipulative and Physiological Therapeutics in JMPT, and was our first attempt at objectifying the chiropractic approach to managing the leading cause of death and disability, which is high blood pressure. And of course, the results were tremendous. All patients ended up eliminating the need for medications. We then published a second paper that actually appeared a year later in the Journal of Alternative and Complementary Medicine. And that was looking at people that had borderline hypertension and using the same approach of fasting and a plant-based SOS-free diet. And we're able to demonstrate proportional results there. These are a significant population because 68% of the people that die from the consequence of high blood pressure don't have pressure high enough to justify the risks of taking drugs. The reason they don't give everybody drugs for high blood pressure is more people would die from the drugs than from the high blood pressure, unless your level of hypertension is raised to a relatively high level, that is above 160 milligrams of mercury on the systolic blood pressure. So those people that have borderline levels of hypertension, you don't want to medicate them because you kill off even more than the hypertension does, but they're completely responsible to a conservative chiropractic approach, which is diet, sleep, exercise, and in our case, the use of medically supervised fasting. We were then began publishing case reports on more specific conditions. Most recently, we had a patient with follicular lymphoma, stage 3 follicular lymphoma. This is lymph cancer involving upper and lower extremity. She had very large, palpable lesions. Her primary doctor was not supportive. He said the diet didn't matter and that fasting was criminal quackery. Her oncologist wasn't really much more supportive. He also didn't think diet was relevant. But told her that, if it'd make her feel better, do whatever, and then they could begin conventional treatment. She had been progressive for about 2 years without treatment because the medical treatment for lymphoma notoriously is not particularly effective. So in any case, she came in, underwent 21 days of water-only fasting, during which time her tumors completely disappeared. She recovered, refeeding for 10 days, went back to the oncologist, and who kind of did the double take because he examined her. He couldn't find any lesions. Checked out the chart, checked her out, asked her what happened. And she says, well, she went to the chiropractor and did the fasting, and the tumors all went away. And he was a little bit surprised and said, well, he would have to give us a call. But because she was still neutropenic, he thought it would still be a good idea to do some chemotherapy. She decided to defer on that, continue to follow the diet. And long story short, at a year, her white count had normalized. She still had no evidence of tumors, went back to the oncologist, who gave her a clear bill. At that point, we decided to publish this case report. We had pre-post CT scans, had all the follow-up data. And so I wrote to him and I said, thank you so much for all the confidence you've showed in referring your patients for chiropractic care and conservative management of her lymphoma. And as I'm sure you expected, of course, she's gone into full remission, and we're looking forward to working with you and tracking her success in the years to come. And now that our paper's been submitted and, as it turns out, accepted for publication in the British Medical Journal, we'd like to invite you to sign on as co-author of the study. It's been 2 years. He hasn't called back yet, but I'm sure it's only because he's busy. In any case, we did manage to publish that paper just actually about 3 months ago. And on that paper and all the studies that I've mentioned are available on our website at truenorthhealth.com, and they're all under the learning channel there, as well as many other case reports. There's also some videos and lots of good content available. I would like to mention that we have a program available for life students, which is part of the preceptorship or peak experience. They can come for a month, they can come for the last quarter of school, or we also have a residency program where people come for longer periods of time where they can actually work in an integrative medical setting. They can work with patients that are sick that actually get well. That's actually the most novel experience for most of our interns, is they actually, for the first time, actually get to see people recovering from diabetes and hypertension and autoimmune diseases and these other conditions that we routinely treat. And we do it using nothing but chiropractic methodology. That is the use of diet. That's an exclusively plant food diet free of sugar, oil, and salt. Exercise and fitness training, sleep hygiene, chiropractic manipulation, physiotherapy. We also have naturopaths and acupuncture, some other modalities that we use in addition to chiropractic adjustments. And this approach, just like they teach you in school, actually works if you can get patients that are willing to do dangerous and radical things like eat good and exercise and go to bed on time, and when appropriate, undergo fasting. So it's very exciting for us in terms of doing the research, and it's exciting for students to actually develop the skills that it takes to actually get sick people well.
Yeah, that's so exciting to me. I mean, I feel like so many people go into chiropractic school or really naturopathic school or whatever, is your preferred method of medical training to get people well. And we get out into practice, and that's not always the reality. And so I wonder, was there anything early on in your career that kind of guided you in this specific direction? I mean, was it pretty clear to you that this was the type of work that you were going to be doing when you started out?
Yeah, I knew from the time I was 16. And I was motivated because my colleague, in fact, he's our clinical psychologist here, Dr. Doug Lyle, and I grew up together from an early age at 4th grade. And he always used to beat me in basketball, and that really pissed me off. And so I thought, I practiced, but so did he, so it didn't help. So I thought, well, I'll get healthier than this. So I looked into things like chiropractic care and nutrition, and I thought, well, I'll just get healthier, and then I'll crush him. The problem is he adopted the same diet and lifestyle changes, and to this day he still beats me badly. So it was a terrible failure. But it did get me interested in this whole kind of approach. I was motivated in part by my uncle, who was a medical doctor, who said that nobody should go to a chiropractor. He said that I could not become a chiropractor. He said, better I should be a communist spy. And so my father took me aside and he said, your uncle is a very prominent physician, and he does not like this idea of you becoming a chiropractor son. And he said, anything that makes him that angry and mad, well, it can't be bad. So good luck to you with that. And he encouraged me. And it was ironic, actually, up until the time that he said he wouldn't review our data until it was published in a peer-reviewed journal. 2 months before our first paper came out, he died of a cardiac arrest. And to this day, my mother swears he died just so he wouldn't have to admit he was wrong. I think it was his diet, frankly.
That's too funny. I'm really glad that your father was so supportive and really saw how important that was. It seems like you have been given a great opportunity to teach at a lot of really amazing schools. Can you talk a little bit about what kind of curriculum you've been able to offer at those different institutions?
Yeah, well, the classes that I've taught, including for a number of years at Bastyr University, was clinical fasting. So we teach about how to use fasting. What I'm doing now mostly is I do grand rounds with a number of the schools once a year and do a presentation on an overview of the work that we're doing, the research that we're doing, and the application that you can use in terms of the aggressive approach with diet, sleep, exercise, and fasting in treating some of these chronic degenerative diseases. I'd like to also mention, though, there's a number of patients that many chiropractors occasionally come into contact with. They have chronic back pain or inflammatory conditions that don't respond to outpatient care alone. And most of our patients, they come in with their back pain, their headaches, you treat them, they get well, and that's the end of it. But every once in a while, you'll get somebody that takes a more aggressive kind of approach. You have to control their environment, their lifestyle to a greater extent. And that's one of the cool things at the True North Health Centers. Because the patients live here, we're able to not only control their diet, their sleep, their exercise and fitness training, their environment as a whole. And so you can really put that whole package together. And oftentimes that's necessary to overcome these people that have these very significant chronic degenerative conditions that don't respond to outpatient care alone. Sometimes it's just getting them to quit smoking and getting them off all their stupid drugs and unwinding all that allopathic treatment that's creating so much problems. Not to mention getting them consistent, appropriate chiropractic care. So, it's nice to see that even in those cases that maybe are difficult to manage on an outpatient basis, we do have another option, which is to put them in what we call our sign should say the last resort, because it's oftentimes where people come when they're really seriously motivated. Oftentimes that means very seriously ill.
Yeah, and it sounds like it's working for a lot of those people who finally do, take the leap into trying something new. And what's so interesting to me, and maybe you could speak to this a little bit, is like there actually is not that much that's new about changing people's diet and lifestyle and sleep habits for improving their health. And so have you found that your treatment programs or protocols have changed a lot over time, or have they stayed pretty consistent?
Pretty much what we do today is what we did over the last, I've been in practice 32 years here. The difference is we can explain why it works better. It's the same thing that's happened. Look, the chiropractors doing the same thing we did, since D.D. Palmer figured out that restoring normal joint function was a positive thing. But now we can explain better why it is we can see the results that we can see. And we're maybe a little bit more sophisticated about determining who's likely to respond or who's less likely to respond to the care that we provide. And so we say we specialize in treating patients that are going to have good results. Because it turns out that if you have patients that are highly motivated and they end up with good results, they'll put up with pretty much whatever you want them to do, including changing their diet, using their body properly, exercising. I have to admit, we see pretty much everybody else's best patients. They're most motivated, either motivated by intellect or motivated by pain. Whatever it is, I don't care. As long as they do what we tell them to do, they get a good result and make us look good, I'm happy. And they do forgive you, even for long term. Like we do fast up to 40 days on water only. That's not a simple process. That requires a motivated patient. But, in the end, they're perfectly happy and satisfied because they've overcome the problems that they came in to treat.
Yeah. In terms of that motivation piece, I find that, behavior modification or behavior management or whatever you want to call it is so key in working with patients and managing patients. What systems do you have in place, or how do you really, help people with their behavior?
Well, we have a book called The Pleasure Trap, Mastering the Hidden Forces of Our Mind's Health and Happiness. And it's written by myself and also our psychologist, Dr. Lyle, who happens to be like one of the brightest people I've ever met. And he's a behavioral cognitive clinical psychologist who has a very good understanding of what it is that motivates human beings to make the decisions they make. So he's very helpful in helping us come up with strategies for individuals when they're ready to make diet and lifestyle changes. But honestly, the biggest motivating factor for most people is pain. Pain, it drives behavioral change. And so if you have a strategy that helps people eliminate their pain, you can get their attention. And that's where chiropractors have a huge advantage, because one of the most effective ways of dealing with many of the common sources of pain is actually the use of chiropractic adjustments in conjunction with exercise and physiotherapy. So because that works so well and we can get people out of pain, oftentimes they're willing to listen to you about what it's going to take to actually get healthy and stay healthy, in addition to the exogenous treatments we provide. Obviously, the big issue is getting the diet, sleep, and exercise right. And so, these are the same things chiropractors have been telling people since the beginning of chiropractic care. But having the access to control the environment allows us to help overcome some of the resistance that many patients have at sticking with it long enough to get enough results that they're willing to be motivated. If you just tell a patient, well, go home and eat a good diet, and they feel like crap for a few days because they're detoxifying from their pleasure trap addictions, they're not going to be successful. But if you can get them to the point where good food tastes good and good food feels good, now, okay, you've got a fighting chance to help them motivate them. Same thing with exercise. You tell them to go exercise. They go exercise, it hurts worse. Well, it's hard to get them to. But if you have we have a fitness trainer who's wonderful, David Goldman, and he can show people where they're at on how they begin to use their body properly and get them exercise, kick them in the butt, motivate them. Now they get some success, they're willing to follow your program. And it's difficult when you're a chiropractor and you're trying to have 20, 25 patient contacts a day, and you're trying to move them through an office practice setting. It's difficult to get the time to do the intensive diet and lifestyle education. Here, they have 3 classes a day. So they're going through yoga, meditation, stretching, body use. They're hearing diet, cooking classes, lectures. Then in addition, we have 52 DVDs that they go through at their own pace on all these different subjects. So they're getting this intense education because they're in a controlled setting. They've got nothing else to do except get educated and follow our protocols, undergo their treatment, do what we have to do. So it's a really intense environment. The average stay, they're here 2 or 3 weeks. You can really do a lot in that type of intense educational setting, where chipping away at it in the outpatient office can be a bit challenging sometimes, frankly. That's why I like doing the inpatient more, because you have full immersion with the patient. You control every aspect of their environment. If what you tell them to do works, they experience that.
Yeah, I completely agree with you. I think the inpatient facility that you're doing is completely brilliant and unique. And why aren't more centers doing something similar? I mean, it's just...
One of the challenges are economics. We figured out a way to do it really inexpensively. The patients stay here $149 a night for a private room share bath, and all of their evaluations are seen twice a day by staff doctors, the educational programs, even the incidental services like doing their laundries, everything is included at a rate that's, frankly, less than the local hotel.
Yeah, I'm moving in.
People sometimes literally stay here or there. They get their meals, everything's included. But we can do it. We are a 501c3 nonprofit research-based organization. As a consequence, we don't have a lot of the pressures that other places might have in terms of, stockholders and all that kind of stuff, investors. And as a consequence, we're able to offer a very, very affordable opportunity. You also have to do that if you want people to be with you for weeks on end, because people have to be able to afford the care. And it's certainly not reimbursed, at least inpatient care is not reimbursed by third-party payers. So, this is people are having to pay for their care. So you have to make it affordable, which we've been able to do. That's probably been one of our biggest accomplishments, is figuring out a way to provide a high degree of high-quality care with excellent professionals and yet still make it affordable.
Yeah, that's super inspiring. I'm so glad you brought that up. Well, I just wanted to ask you, how can people get in touch with you? You mentioned the website earlier, but what's the best way for people to learn more about
our website at truenorthhealth.com. All of our articles and studies are freely available. They can download that. We also have something called True North TV, a lot of video clips, lectures, all that stuff. They can contact me directly at 707-586-5555. And my direct extension is 2022. So for any questions, if they're interested in the internship program, they can call me directly or contact me through the website, through email. So we're happy to have students. If any student that would like to have a tour is welcome to come by any time. They'll get a tour of the facility. Students who are interested in training can come in and arrange to do 4-week rotations. There's no cost or fees to any chiropractic student for that. We do provide room and board to our intern doctors. and they're doing rounds a day. It's a very intense internship, but you're hands-on, examining, evaluating patients, sitting in with chiropractors, medical doctors, naturopaths as they go through evaluating these patients. So really good learning opportunity. If this is Life West that we're talking about right now?
Yeah, primarily.
I haven't been speaking at Life West, but if anybody would like me to come out, I'd be happy to come out to the school and do a presentation like I do at the other colleges on clinical fasting. It's certainly something I'm happy to do. You guys are close by. And if there's anything that we can do to help students learn more about this, we're just absolutely totally motivated to help chiropractors understand that everything they're learning in school actually works if they can figure out a way to implement it.
Awesome. Well, yeah, thank you so much for your time. Thank you so much for all the information that you've shared. This is DC2B Revolution, where students are investing in the future of chiropractic and really helping students to create the practice of their dreams and really do what is going to help humanity the most. So if you like this video, please subscribe to the channel, or say if you have any questions, go ahead and leave them in the comments below. And yeah, I'll see you next time. This is Noah Volz signing off. Thanks again.
Very good.